Health is not merely absence of disease. Rather, it is presence of vitality. It is presence of energy, and it is presence of confidence in your own self. Hi, in this video, I'm going to be talking about what is the meaning of health mentoring. See, we live in a world where our definition of health is evolving. Health used to be considered absence of disease for years. Being a doctor in a medical profession for now over 2.5 decades, anybody who does not have disease is considered to be healthy. But I'll tell you that definition is changing. Health is not merely absence of disease. Rather, it is presence of vitality. It is presence of energy, and it is presence of confidence in your own self, in your own well-being, such that you can be the best version of yourself and be of service to others. And that is the basis of health mentoring. It is more of health care rather than disease care, because our current health system is catering to diseases by way of prescribing pills and by way of doing more procedures. Now, don't get me wrong, I'm a surgeon, so I know the value of procedures. Procedures are life-saving. I have done that all my life as a medical practitioner, as a surgeon, and I'll continue to serve people who need procedures. There is value for that. But I'm also a yoga and a meditation teacher that has allowed me a deeper insight on how an integrative approach, bringing the body and the mind together to create an individual's healing and the value that it brings to the individual. And that is what is called health mentoring. In health mentoring, we bring in the different elements of what allows the body to heal, combine it with the mind, the gut, the heart, and the soul. Now, I know when you hear all this, people think, oh my God, this seems like a lot of hard work. But trust me, the philosophy that we use is that of 1% change. We only want to be 1% better than how we were last week, last month, or even last year. Yes, that may sound a very slow progress, but I'll tell you, if you want to shift a big battleship which has been going in a certain direction for years, you only do it 1 degree at a time, and slowly you begin to realize within a short span of time, the whole direction has changed. So, what are the conditions that we deal with in the health mentoring sessions? See, health mentoring sessions are targeted towards the chronic conditions, the epidemic of chronic inflammatory conditions that our current society is facing. We have gotten over conditions which were born out of infection in the previous century, such as smallpox, such as polio. They are extinct now. There are other infectious problems, which I get it, such as COVID and all of that. But at the root of all of this, there is inflammation at the basis. So, the conditions that we address in health mentoring sessions are, number 1, weight issues. Weight management is not just about managing your calories and how much exercise you are doing to burn those calories. It's really about optimizing your metabolism. Second, we go deep into the management of gut health related issues. Now, irritable bowel syndrome, heartburn, constipation, diarrhea, food allergies are a big issue that are associated with gut health problems, and this is translating into gut inflammation and inflammatory bowel disorders such as Crohn's and ulcerative colitis, which is rampant in our society. The third is that of chronic fatigue syndromes. They are also called as fibromyalgia or chronic pain syndromes. This is again something for which modern medicine does not provide a miracle pill or a miracle cure, because at the root of it lies inflammation. So that is the fourth thing, such as chronic inflammatory disorders, which is manifesting as autoimmune conditions. And that is where, the basis of all the problems, thyroid conditions, allergies, skin conditions is arising from. And the last and the most important is, which is somewhat related to weight management, is that of fatty liver. Fatty liver is such a benign and a common condition, but I tell you, this is now becoming the commonest cause of liver transplant in the developed countries. The reason is that fatty liver can progress to this condition called as NASH, which is non-alcoholic steatohepatitis, which can then progress to liver cirrhosis and liver failure or development of liver cancers. So what to expect in a health mentoring session? As I just mentioned to you, health mentoring is really an integrated approach. We bring the body on one side, which really represents matter, the physical aspect of it. But we know from decades of work in medicine that pills and procedures by themselves alone do not cut it. In fact, I get so many patients who are sick and tired of taking pills. They are at their teeth's end, saying that we are now experiencing side effects of medications and we don't want more medications. On the other aspect of the approach, the integrated approach that we apply, is that of the mind. And by that, what I mean is the energy behind this. See, if an individual is depressed, they have got low energy state. They have got just no energy to heal. Whereas when you uplift the individual's confidence, when they start seeing some small tangible results, their energy levels go up. When they improve their diet, it leads to improvement in energy. When they let go of those negative emotions that they have been harboring for decades and for most of their lives, those emotions of anger, guilt, fear, resentment, and most importantly, when they find their purpose, that is what allows the energy to come up. See, there are no crystals that we use. There is certainly no black magic. There is no woo-woo stuff that I believe in. There is evidence-based stuff. But I say that we do not wait for science to give us permission to do what we believe in. We will do the strategies that we employ and the techniques that we employ by going deeper into these states and unraveling what exactly is holding our energy back, such that we can optimize the electromagnetic field, optimize the physiology, optimize the metabolism that calms down the inflammation in the body. I don't believe in long-term medications, long-term prescriptions, but I also recognize the value where medication and pills are required. I also recognize the value of supplements where they are required. But as Hippocrates, the famous father of medicine, has said, that if your diet is wrong, medicine is of no use. If your diet is right, medicine is of no need. So pay attention to that. And that is where we draw up a whole structure for the individual. We draw up a routine for you. We plan how your day needs to look like, such that you are slowly changing in the positive direction by 1%. 1% every day. 1% every week. That's it. Because then it becomes achievable. If I tell you to move 10% or 20% every day, you'll say this is too hard, I can't do it. Besides this, we work on the 5 pillars, which is the mind. The mind receives the information. How do you make mind more receptive? By working on stress management and by working on the repair mechanism. And one of the key ones is that of sleep. Sleep is repair management. Then we work on the body, where we develop a system where your body actually has an experience by the knowledge that you're getting from the mind. Then we move on to the third pillar, which is that of the gut. The gut is not just about having a certain diet, having organic diet and this. It is also about understanding what your gut and brain are communicating, because there is a solid gut-brain axis which is allowing us to tap into that intuition, the inner guidance mechanism. And then we move on to the next pillar, which is that of the heart. And the heart is the seat of your emotions, which is where you are carrying all those negative emotional states of anger, guilt, shame, lack of forgiveness, which is causing you to drain and leach all your energy. And when there is no energy, where will you have the energy to heal from? And the last and the most important step is that of finding your purpose. That is the pillar of your soul. See, I say this, that the health of your body is a direct reflection of the health of your soul. If your soul is healthy, if your soul is on purpose, you have found your life mission, I tell you, everything else takes care of itself. And that is a part of the health mentoring session to allow you to find your purpose. So I hope this gives you an overview of what to expect in a health mentoring session. If you've already booked it, I'm so looking forward to meeting you. If you haven't, do explore this further and see where you would benefit from a health mentoring. It may not be necessarily from me. You could get the health mentoring from anybody else. But if I can be of service to you, I would consider it my privilege. So take care and stay safe.